Hello everyone, this is Dr. Shraddha Thakur, consulting gynecologist in Nelson Hospital. So today we'll be talking about periods. There are a lot of questions which are there in the mind of young girls who are facing through troubles during periods, which we'll be solving today. Now, why do you have periods and when do they start? These days the age has got reduced to around 8-9 years also. So the mother, you should be prepared about periods and give information to the girls as early as possible, maybe 7-8 years or so. They should be having a little knowledge about it. So periods start when the hormones from brain start to secrete and your reproductive system start to function. There can be multiple problems associated with periods in the initial 3-4 cycles, like increased bleeding or pain in the abdomen. So they should be prepared about this thing. If they do not last for 3-4 months or get extended beyond it, you should be consulting a doctor, because this will reduce her hemoglobin also and will cause trouble later on. And there can be some other reasons why it is happening. If they get okay in 4-5 months, you need not worry about it. Periods usually last for 28 to 35 days. This is a normal cycle, usually 22 to 35 days. If it is lasting for less than that or more than that, then you should be seeing a gynaec. More flow can be normally seen in first few cycles, but if it lasts for too long, can be due to some blood disorders or hormonal imbalances, which has to be corrected on right time. Otherwise, it becomes a permanent problem. The most commonest problem these days we are seeing is polycystic ovaries, which has started to happen earlier these days because of the lifestyle changes which has happened. Young girls are not exercising, they're not eating proper diet, which is the main crux of the things. We used to have good diet and exercise, so that's why the periods used to be very regular. And girls need not visit gynaec before planning for pregnancy. Second is more secretions during periods. So there are few days of your periods when you are making eggs and secreting. So these days you will have more secretions compared to the other days, which is completely normal. Only thing concerning will be when it is foul smelling or it is curdy white color. So if that is the case, you should be seeing your gynecologist. Your fertile period when you are prone to conceive is roughly 9th day, between 9th day and 16th day in a regular cycle. In an irregular cycle, you cannot assess when exactly you are ovulating. So you have to be very careful about contraception. Then before periods and after periods, some girls experience a lot of body ache, headache, nausea, vomiting. These are called